This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Alex Menze, and I am a general neurologist with the Permanente Medical Group in Sacramento, California, and I also serve as a flight surgeon with the 129th Rescue Wing in the California Air National Guard. Today, I'm interviewing Marianne Chanti-Ketterl with the Department of Psychiatry and Behavioral Sciences and the Center for Aging and Human Development at Duke University Medical Center in Durham, North Carolina. We're going to discuss her paper, published in Neurology, titled Associations Between Traumatic Brain Injury and Cognitive Decline Among Older Veteran Men, a Twin Study. Hi, Marianne. Thanks so much for joining us today.
Oh, thank you for having me, Alex.
I was fascinated to read your research, and generally, I prefer to save the results for a few questions in, but I think our listeners would benefit from hearing about the discoveries up front. Would you please give us the main positive results that you found?
Our study showed that veterans who reported having at least one traumatic brain injury, or TBI, at any time in their life had lower cognitive scores in later life compared to a twin sibling who did not experience a TBI. So what is really unique about our results is that our study showed a faster rate of cognitive decline among the twins with more than one TBI, those whose TBI resulted in loss of consciousness, and those whose TBI was after the age of 24. And it is this faster rate of cognitive decline that is something that had not been reported in the literature before.
So let's back up a little bit and talk about where the data from this paper came from and how you and the research team were able to extract the evidence and identify the eligible participants for this study.
This has been a labor of love. The participants for this study, actually, they're all male members of the National Twin Registry of World War II veterans who were born between 1917 and 1927. And this was a registry created back in the 1950s using vital statistic records. However, the cognitive function and the TBI data for the study was collected as part of the Duke Twin study, which my mentor and primary investigator of this particular study, Brenda Plasman, and her colleagues collected back in the 1990s from the twins via the telephone and in-person interviews.
So Marianne, tell us about another part of this study. One of the things that was really important was the TICS-M evaluation. And what does that mean? What is the TICS-M? That's TICS-M. And could you tell us some of the finer details of what these results were all about?
The TICS-M stands for the Modified Telephone Interview for Cognitive Status, so we'll just call it TICS from now on. It is a brief assessment of cognitive function. It's, like I said, administered over the phone, and it evaluates cognition via orientation, language, calculation, and memory, and is very similar to other brief cognitive assessments that many of you neurologists and geriatricians used in your practices when you evaluate patients. Now, I know this is a little perhaps biased, but in my opinion, it assesses memory ability better than some of the other cognitive function tests. So I think it is a stronger tool to detect earlier memory changes. And here we commonly use it to screen people who are interested in participating in some of our cognitive epidemiological studies. So for brevity, I'm just going to jump right in and tell you about our matched co-twin control analysis, which is the highlight of this twin study design. And in statistics, we do this by analyzing twin pairs who are discordant for TBI. That is when one twin experiences a TBI, but the other twin brother does not. And so when you look at the data this way, it's very exciting, at least to me, because we can account for those genetic and environmental factors that are shared by that twin pair. And usually these factors are things that have not been identified. And as a gerontologist, there are many factors throughout life that can affect late life cognitive ability. However, it's always really hard to measure those in later life. And so this makes it very difficult to identify what actually impacts cognitive aging. But when we study twin pairs, those factors are inherently accounted for. So we have more confidence that when we identify an association between a factor such as TBI and poor cognition in later life, that poor cognition is really due to that TBI and not some other unidentified factor. And again, I just love this type of studies because we can go a step further by separately studying identical and non-identical twin pairs. So, for example, If we observe differences in cognition in only one twin of those genetically identical twin pairs or the monozygotic pairs, we can conclude that the difference in cognition is due to the TBI, which is the environmental exposure, because the twins share almost all their genes, right? But if we do find the difference in cognition only among non-identical twin pairs, then we would not be able to rule out that the association is due to some shared genetic factor. Now, this is a very strong approach to support the causal nature of the relationship we're studying. So, for instance, in our study among identical twin pairs, the twin who had a TBI scored over half a TICS point lower than the identical twin brother without the TBI. Now, another finding was that the twin who had a TBI after age 24 scored almost 3/4 of a TICS point lower and had a faster rate of cognitive decline compared to a twin brother without the TBI.
Thank you for that, Marianne. It sounds like the TICS scores were different between the monozygotic twin pairs and the individual who had TBI by somewhere between a half and 3/4 point. Now, on this TICS scale, would that be that big of a difference in cognition? I think that some may consider that the difference in the TICS scores with the TBI sufferers compared to the brothers without TBI might be clinically irrelevant, even though the results achieved a level of statistical significance. What would you say in a response to that assertion?
That is a fair question, Alex. Some reviewers did ask that as well. I'd like to answer it with the example I just gave you. If we were to multiply that effect size by 12 years, which was the length of the study here, we would expect that the twin with TBI, who is declining faster, to drop almost a TICS point more than the twin without TBI. And that could mean a difference between triggering for further and really more in-depth cognitive evaluation versus not. And so I do believe that it is clinically relevant. Now, as I said, I understand that just a TICS point is a very modest number. That's true. But another point I really want to make is that this difference is in cognitive ability. It's just the TICS point is the impact of just the TBI on cognition. In this analysis, there were so many other factors that we know are detrimental to later life cognition that we accounted for. So most studies, of course, include demographics and some lifestyle choices such as smoking and drinking. But here we also accounted for many medical conditions, cardiovascular disease, cardiovascular risk factors, depression, and other neurological conditions on top of all the genetic, environmental, early life factors. So again, I think that the poor cognition associated with TBI that we found in this study speaks to the contribution of TBI above and beyond all those other factors.
Yeah, so to have even a single TBI associated with a change later in life, showing this change and to be certain of that, that's some impressive information. Marianne, what do you make of the finding that head injuries after age 24 seem to correlate with a greater degree of cognitive decline? I had always assumed, perhaps mistakenly, that early TBI on the developing brain might lead to more cognitive problems. This data that you have suggests that the opposite is true, and I'm curious if you have any ideas as to why this might be.
Definitely, this is something that needs further studies to look into it. Yes, our results for TBI after age 24 do speak to TBI impacting not just the cognitive level, but also accelerating the cognitive aging. One thought that we have is that younger brains are more resilient to recovery, and they may be more capable of activating a faster remyelination process, which at older ages, just like most other systems, are less efficient and may just end up happening at a slower rate. So that's a thought, but this is just a hypothesis that definitely will need more research into.
What about the multiple TBIs versus single TBIs in this data set? Was there any correlation between an even greater relative cognitive decline in those with multiple traumatic brain injuries compared to those with just single events?
Yeah, this definitely has gotten a lot of media attention. So the answer is yes. Those with more than one TBI actually declined faster per year in the study. This was significant. It was almost double the rate of the decline of the twins who had a TBI after age 24. So again, this is something definitely that needs further studying, and we'll definitely have to be looking more into it.
Well, just more reason to wear your helmets and protect your head, I suppose.
Absolutely.
This just keeps getting worse and worse. Just to protect that noggin, I suppose. Marianne, could you please tell our listeners why this study is unique and if there are opportunities using this data set or other data sets like it in the future.
I was not familiar with twin studies before, and this was definitely a learning curve, but I'm a true twin study lover now. Twin studies allow us to control for, again, all those early life factors and genetics that we can't account in any other study design. I mean, these are factors that are known and unknown that may impact cognitive function later in life. So we're not just here comparing two totally unrelated people who may not share much in common. We're comparing twin brothers, with some even being identical twins for that matter, who share environments from conception until probably young adulthood. And it really doesn't get much more control than that. It's the ideal, the gold standard, right? I do hope that through our study, we convince others of the value of the twin studies. And I'm sure, at least I really expect that there will be other studies in the near future that will replicate and further our findings in many of the other twin data sets around the world. So yeah, I hope that there's more to come.
I certainly hope so too. It's just the duration of this study and the magnitude of the data sets to come up with this. It seems like it might be hard to come by, but I appreciate your work very much. And it's just more information for us to know that protecting our brain from injury is so important for our longevity and our cognitive function.
I agree.
I've been speaking with Dr. Marianne Chanti-Ketterl about her twin study research on the associations between traumatic brain injury and cognitive decline among older veteran men.
Thank you so much, Alex.
This is Stacey Clardy, your podcast editor. Thank you for listening and for letting us join you on your commute, while you're exercising, or even while you're brushing your teeth. This has been another episode of the Neurology Podcast, your best source of practical, relevant, and timely information for neurologists, clinicians, and patients.